I think the thematic working group on private sector offers a number of opportunities to understand the private sector a little better, the kind of actors that define the private sector today. And I think the opportunities it offers are for researchers to exchange evidence and knowledge on the private sector with each other across countries, to gain greater insight into the workings of the private sector in relation to quality of care, in relation to innovations in the private sector, as well as issues like regulating the private sector, which I think is an increasing concern to health systems researchers across the world today.
So this is quite a voluntary group which came together as a result of many of us who have very similar interests in the private health sector. We used to meet in different health symposia, like the AHIA Congress, like the health systems global symposiums, which have been held in many different countries.
The members of the Thematic Working Group all share an understanding of the importance of the private sector and of health markets, and a commitment to move beyond ideological understandings to find practical approaches for engaging with it to improve its performance. This may involve research, but also interventions or organization by citizens groups to improve performance. We have members from a large number of countries on every continent.
I think it provides great opportunity to integrate and collaborate the researchers working in the private sector and policymakers and implementers and donors, and engage them into the debates and dialogues.
Really excited to say that we are actually looking at an innovation workshop program in Bangalore with one of my other colleagues who's on the working group, Priya, and our team. So this will really be about how do we use innovations in healthcare? How do we use innovations to frame interventions? How do we collaborate around innovations and actually grow them so that they're sustainable, effective, and used across, south-to-south collaboration. 2019, the group will probably come to Africa and participate in the Africa Health Agenda International Conference.
Well, we are looking forward to the preparations for the 4th Global Symposium on Health Systems Research, which will take place in Liverpool in October next year. And I think the Thematic Working Group will be having an important role in putting together some of the sessions. And I think we will be participating actively in this process.